Hello, I'm Bruce Goldstein with Farmworker Justice in Washington, D.C. Farmworker Justice is a national advocacy group, a nonpartisan, not-for-profit organization that advocates, litigates, and educates on behalf of the farm workers in this country. Welcome to the Facebook series, The State of Farm Workers in the COVID-19 Era. Through this series of programs, we are highlighting the fact that farm workers have been designated as essential workers who need to work to keep our food and agricultural systems going. Yet, they are often facing dangerous living and working conditions. These programs raise awareness about the serious challenges the pandemic imposes on farm workers and their family members each and every day. It also identifies creative solutions that individuals and organizations are engaged in to try to help farm workers confront the pandemic. We're very, very fortunate today to have the presence of a representative of the United States Congress, Representative Raul Ruiz. Welcome, Congressman. Thank you very much.
Always a pleasure to be with you.
Congressman Ruiz represents the Coachella Valley in California. He's a physician, and we've worked with him on a number of public health issues, including telehealth in rural communities. So we're very fortunate to have him here today. He's also the chair of the Healthcare Task Force of the Congressional Hispanic Caucus. Congressman, please tell us about your background, how you came to be a physician, and how you came to be a member of Congress.
I think the biggest question is, why do I care so much about farm workers? And it goes back all the way to my upbringing, because my parents were farm workers, and they met in the fields. My dad was a mechanic out in the fields. My mother would harvest grapes, and they got married and had my older brother. We lived in a trailer for the first few years of my life. My dad was promoted to work in a packing house. And that's how we were able to move from the trailer into the home in Coachella, where my mother still lives. My older brother was the first to graduate from high school in the whole family, and he was the first to go to college, and I followed, graduated from high school and also going to college. So I am from the community. I understand the community, and my mother and my family still work in the community. And so I understand the struggles, the plight, and the experiences, especially with healthcare, because it was in the community that I dreamed to become a doctor and to come home and to serve the community and fight for health and social justice and to address all the disparities and the inequalities and the pain and suffering that poor and marginalized communities experience needlessly. And so that's why I became a doctor, and that's always been my lens and my mission first and foremost. And then in 2012, I decided to run for Congress without having held any political office or even participating in any campaign. So I ran for office, and now I'm in Congress in Energy and Commerce Committee, where I serve in the Health Subcommittee, the Oversight Committee, and the Environment and Climate Change Subcommittee. And as you mentioned, I'm the chair for the Congressional Hispanic Caucus Health Task Force. And so this has been a very important issue. I'm board certified in emergency medicine, was educated at Harvard Medical School, the Harvard School of Public Health, and the Harvard Government School called the Harvard Kennedy School, where I also received a master's in public health and a master's in public policy. So this is my specialty. I worked in the emergency departments during the H1N1 pandemic. Before running for office, I did a lot of community health projects in farm worker communities. And so my training in public health is also in disaster aid. And so this is an opportunity for me to really be helpful in this sphere.
And that's why we're also so fortunate to have you on our program. And you're from the community. You're from Coachella. In fact, you may know that we had the mayor of Coachella, Stephen Hernandez, on our program last week. He did a great job. A lot of our listeners probably know Coachella more for the music festival, but it is a major agricultural production area. So please tell us about the Coachella Valley and the farm worker community that you represent.
Well, it's interesting. The Coachella Valley is a microcosm of our nation. We have people from all walks of life in the Coachella Valley. The top three industries are agriculture, tourism, and healthcare. Healthcare, because we have a retirement community. We have 50% of our population are 55 years old and older, 30% are 65 years old and older, and tourism, because we have beautiful weather. This is God's place in the winter, and people come here and they have second homes here. And then we have amazing festivals like Coachella Festival, and we have the Stagecoach Festival, and we have a lot of different regional festivals, including some pretty phenomenal tennis tournaments in the area in Indian Wells. At the same time, we have the other industry is agriculture. It's an $80 billion industry. We are mostly specialty crops. It's not like the large farmers. We have citrus, watermelon, bell peppers, grapes, dates. We are one of two districts in the whole country that produces dates, and so this is a very agriculturally oriented community, alongside tourism, alongside healthcare. But at the same time, you have some of the richest cities per capita in the entire country, right here in the desert. 20-minute drive away, you have one of the poorest areas in the country, where people live in squalor, where they don't have adequate shelter, they don't have access to clean water, where there's a higher level of environmental hazards in these poor communities, where when I was growing up, I would see farm workers sleep in cardboard boxes, that there are some natural caves in this area called Box Canyon. It's a state park where farm workers would stay and sleep in cooking outdoors. So, there's a dichotomy of worlds, a juxtapositions of the very affluent and the very indigent. And so that is the makeup of the Coachella Valley, especially in the agricultural sectors, compared to the central area, where you have the very fancy golf courses and the country clubs and the affluent's third homes.
Right, and I've driven from wealthy Palm Springs down to Coachella and Indio and other farm worker towns. I've seen the workers up really high in those date palm trees. And my colleague, David Damian Figueroa, who lives there, works from there for us, was telling me just a few days ago, it was 106 degrees and farm workers were out in the fields.
Yeah, we've had people faint. I mean, I worked in the emergency department. I take care of either some farm workers or some gardeners who work outside in 115, 120 degree weather. Sometimes they have to work. Their work hours are very limited. Either they work very, very early or very, very late in order to avoid the middle day heat. And it's important to note that the baseline of the farm worker experience is already one that puts them at a higher risk of morbidity and mortality. The highest by far of occupational injuries and hazards are in the farm worker industries, okay? In addition to that, although they take the brunt of the highest risks in their occupation, they are one of the lowest paid professions in the country. And they live in some of the most medically underserved, educationally underserved communities in our country. So you have the higher risk, the inability to pay for school or for medicine or for healthcare, oftentimes being uninsured because of the part-time kind of nature of the mayordomos and the people that recruit the different workers in the fields, and the way they're seasonal and they work from one field to another. Oftentimes they're uninsured unless they can qualify for the Medicaid program. Then on top of that, you don't have doctors or nurses or public health programs in their communities. That's why you see a lot of illnesses. You see a lot of asthma in farm worker families. You see a lot of cardiac problems in farm worker families. You see a lot of musculoskeletal problems in farm workers that become arthritis, that prohibit them from enjoying their elderly years because they're so banged up from working so much in their youth. In addition to that, you have high rates of diabetes. And because of metabolic syndromes with not having enough nutrition, which is so very ironic and so very outrageous to me, that the ones who are picking the fruits and vegetables are the ones unable to afford to eat the fruits and vegetables to maintain their health. Oftentimes they go to what's affordable, which is a fast food restaurant or processed food so they can last for their families, and therefore they become obese and they have other metabolic syndromes. So this is a real problem. It's a problem of health disparities, health inequities, social justice, and that's why I've devoted my studies, my career, my policies in addressing these type of injustices. And all of that is playing out in COVID-19. All of those underlying disparities put farm workers at a higher risk, not only of transmission, but of also mortality if they get infected. So as I mentioned, there's a higher rate of diabetes, cardiopulmonary illnesses in poor Latino and farm worker communities. So if they get the virus, they're at higher risk of severe illness and potentially dying from the virus. Second is you have a higher risk of rapid transmission within the community. This is for two different reasons. One is because in the workplace, it's a tinderbox for potential outbreaks because they may not be provided the masks. They may not be provided ample space to work 6, 8, 10 feet apart. Oftentimes they're working bunched up. The packers especially have to work in a process line and the fruit is moving fast. And they have to sort them out and work very closely to one another. They don't have enough breaks or time to go wash their hands with soap and water. In fact, there's no running water or soap out in the fields. And so that's another issue. So there's these workplace precautions that aren't afforded to them. Second is that they're essential workers. So they have to go to work, right? So they have to go to work and they're working in conditions that might not be amenable to practicing social distancing precautions and all the personal hygiene like washing your hands that they need to practice. In addition to that, when they go home, if they get the virus, they cannot self-isolate from their families. So we're all in this together, but we're not all on the same boat. Some people are on the yacht during this pandemic, while others are on a raft. And farm workers oftentimes live in tight spaces, trailer parks. In fact, there's a shelter in Mecca that house those that are homeless, essentially. And so they're even in tighter quarters, but most farm workers don't have the luxury of isolating themselves in their own room, right? Or have the resources to go and rent a hotel room or go somewhere else to be away from their family. So chances are, if they get sick, they're going to take it home and they're going to be spreading the virus within their family, which is not good because somewhere there's an abuelito or an abuelita with diabetes, right? And that's a problem. So in addition to that, there hasn't been a concerted effort for outreach in Spanish information or even the testing or treatment or contact tracing within poor, hard to reach farm worker rural communities.
Right. Yeah, thank you. And one of the cruel ironies, besides the fact that farm workers are producing the food that they often can't afford to pay for, is that they are at greater risk for occupational injuries and illnesses. And yet farm workers are excluded from many of the federal occupational safety protections. So it's kind of both cause and effect. The lack of protections means that they're going to have higher injury rates and illness rates and occupational fatalities. And so we're all working on it. But you've identified a number of the, that was a great summary of the challenges that farm workers are facing. We're hearing from groups that we work with all over the country that although there are employers who are trying to follow the CDC recommendations, a lot of farm workers are telling us that that isn't the case, that they are not receiving adequate information about COVID-19 in a language that they understand, that they are not being provided with adequate hand washing facilities, that they're not being provided with masks, that they're expected to work in groups. Many farm workers, as you know, are transported sometimes long distances, sometimes short distances, because they can't afford their own cars. They're put into vans or buses, and often those are crowded. And then they're often, as you mentioned, living in crowded situations, partly because their wages are so low. Even if they could afford to rent in a house, it's multiple families renting in one house that may have been designed for a single family. And so that's what we're hearing, from around the country. And for the reasons you said, we're very nervous that we haven't seen the worst yet, because the harvest seasons in many places are really just beginning. So I wanted to ask you, though, what you're hearing, about the experiences of farm workers during the pandemic in your community.
We've already had an outbreak in a date packing house. We have increasing rates in the communities that farm workers live in the cities of Coachella, Indio, Mecca, Thermo. Those are now the highest. Those communities now have the highest rates of people with coronavirus. And so, in fact, one worker died from COVID-19 from Coachella, who got infected. So I know that there are some growers who have called procuring the testing, seeking guidance. But in Spanish, entre lo dicho y lo hecho, hay un gran trecho sometimes. There's a disconnect, and so unless we see it manifest, we just have to keep providing oversight. We have it's difficult because of the systemic factors that marginalize farm workers exist with COVID-19 precaution implementations. So what's the attention that the county is given for enforcement? Whether it's through the sheriff department, whether it's through the business inspection, environmental health department, or whether it's through Cal OSHA. I do know that Cal OSHA is now investigating the date packing house in Coachella, but that doesn't necessarily happen in all scenarios. And there's no spot checks, there's no come into compliance oversight and going around and doing inspections to make sure that workers are safe. A lot of it is de puro fe to see if the companies will abide by those rules. And oftentimes it's very hard for farm workers to speak up because it's their livelihood, and they don't want to rock the boat because they got to feed their families. So those are things. And in terms of the lack of outreach, I very early on told the administration that I had not seen any PSAs on TV, radio, or social media. And I told them, given my experience working in disasters, that that one of the most cost-effective ways of saving lives in crisis is information. Give people information and the knowledge to make better decisions to protect themselves and their families during a pandemic, a public health crisis. So in the absence of theirs, I did my own in English and in Spanish. Everything I do in English, I do in Spanish. And we've pushed them out, and Univision and Intravision and Telemundo have started airing them all across the country. Now we're seeing more PSAs coming out of the CDC and the administration. However, we're not seeing enough in Spanish. Very early on, we demanded that they put their content in Spanish as well. I've sent a letter urging them to use Spanish outlets for their PSAs and to make their information, all their information, available in Spanish as well. And we know that radio is a very effective way of communicating with the working class Latinos, because they're in the kitchens, they're in their work, and they have the radio, they don't have the TV on. So we're doing a lot of that. In terms of testing, in terms of COVID-19, Riverside County, just like all counties in the state of California and probably the country, are lacking in testing in general. Now, Riverside County, however, in California is sort of leading the curve in the amount of tests that they're doing per population. But we also have a very large population. It's the fourth largest in the state. And there are different drive-through areas. And we saw that when they moved the drive-through from the affluent central part of the valley to the eastern part in Indio near Coachella, all of a sudden you started seeing more people from the areas get tested and the rates went up. But there's a problem because a lot of farm workers, either they don't have a car or they only have one car, and it's the breadwinner who has to go to work that uses that car. So they don't have a vehicle or mode of transportation to go to the drive-through testing. The second problem is that the hours of testing are usually in the morning when farm workers are out working, and their families don't have the vehicle to go into the testing site to get tested. So what I did is I with some donations from a healthcare system, KPC Healthcare Systems, and with the nonprofit that provides free care in a free clinic that I helped start called Volunteers in Medicine, we worked with nursing students and residents and medical students, all volunteers, and we actually went into the farm worker community and provided testing in the community. And that's a good model that we need to start replicating throughout the country to go to many difficult to reach spots, especially farm workers, to go to the camps, to go to the trailer parks, to go to the public housing and test them where they're at to overcome those barriers in the language that they understand, and to also have contact tracers that are from the community that's able, the persona de confianza, people that the community can trust so that they can speak to them in Spanish and understand, do the interviews so they can identify who may be at risk. And more importantly, we also need resource managers. The social workers, case managers are just people trained in allocating resources so they can identify locations to move people that are high risk or that are infected away from their family and support them with food and medical treatment so that they're quarantined and they can get over the infection while keeping their family safe and distant from the source of infection. If we don't do that, then we're going to see more farm workers, agricultural workers get infected.
And I know that you have another obligation you have to get to, but I wanted to ask you about what is feasible in Congress to pass to help farm workers address the pandemic. We've been advocating for an occupational safety standard based on the CDC recommendations, for paid sick leave, for unemployment compensation for undocumented workers, for an end to that outrageous public charge regulation by the immigration, and a number of other issues, including just general immigration reform.
I support all that. I support all that. And, you know, the hazard pay is very important, uh, and providing economic support for essential workers and their families is very important because it is a lifeline for the nation. I think this is one of those moments where people are now reflecting on the basics of community, food, health, shelter, care if you get sick. These are the basics of the humanitarian standards. And they're realizing the important value that farm workers have to our country. They're often ignored. You know, people go to the grocery store and they just pick their produce, or they get a packaged meal or something, and they go home and they eat, and they don't really reflect on who's in the field taking on the burden of occupational risk and injury, working in 110 degrees, picking the grapes, the dates, the bell peppers, the lettuce, the strawberries, the, you know, you name it, the watermelon, like, and they're enjoying it, but they don't reflect on what it takes and how are they being treated, or the lack of protections, or the low pay, or and oftentimes an incredible amount of abuse that happens, especially for those who fear for their family because they may be undocumented. So this is the time to bring all of that to the forefront, and I did that by highlighting farm workers and doing testing in farm worker communities. And you're starting to see the appreciation, because if we're appreciating the frontline workers, right? If we're appreciating the paramedics and the law enforcement and the hospital workers, if we're appreciating the grocery workers, we also must highly appreciate the farm workers, who is the lifeline that without them, there would be no food in the groceries, right? The farmers, et cetera, the ranchers, et cetera, there would be no food in the, so if you go all the way back to where it starts with the seed, it starts with the dirt, the sun and water. And it starts with one person who puts it all together and who nourishes it, who grows it, who picks it. And then eventually it will get into your stomach and nourish you, whether you live in a shelter or whether you live in a mansion. It is that same produce that feeds America. And it is are those farm workers who sacrifice themselves, who toiled day in and day out with very minimal rest and very little pay, oftentimes with a dream, and one dream, which is to give their children opportunities that they never had, which is what my parents dreamt of. And they do their job well, and they're the best at it. And so this is the time that America needs to reflect on their contribution and their value, and start respecting with changes in the policies, the pay, and the safety measures that farm workers need.
Well, very eloquently said, and we're very much, as farm worker advocates, we very much appreciate your role in the United States Congress, your articulation of these issues, the priority that you've given to farm workers, because there are many, many issues in this world to work on. We appreciate your work on behalf of farm workers, and we look forward to working with you in a way, taking advantage of this terrible crisis to do what you're saying, which is to remind people, and they need to reflect on where their food comes from and how the people who've been producing and providing them with this food have really been mistreated. So thank you.
Thank you. And it's not necessarily taking advantage of a crisis. It's that oftentimes the crisis brings clarity. And it's like at nighttime, the darkness brings clarity to be able to see the moon with full clarity. And the moon really shines a light on many things. but you have to go through that darkness to be able to see the moon. So this pandemic is like the darkness of night that helps us see the value of our farm workers, that brings clarity into our lives. And so that's what this pandemic is doing. Through this darkness, we're having clarity in the value of our farm workers. And that is why we need to serve them, protect them too, because they're an essential part of our ability to maintain our health.
Thank you, Congressman Ruiz. We really appreciate your being part of our programs. Farmworker Justice, for our viewers, is a national advocacy group. It's a nonpartisan group that advocates for farm workers, litigates, and provides information to farm worker groups all over the country. We work on immigration policy, health, occupational safety, wages and working conditions, access to justice, and corporate responsibility in the food supply chain. And our services to farm workers are provided at no cost to farm workers, so we depend on the public for support, so people can make a donation to farmworkerjustice.org. And our upcoming guests this week are Valdemar Velasquez, who's the president of the Farm Labor Organizing Committee, AFL-CIO. He was a farm worker, a migrant farm worker as a child, and has done fabulous work, won a MacArthur Genius Fellowship some years ago for his work in the food supply chain. And we also are having John Quinones, well known as an ABC News journalist, but he was a farm worker as a child, and he'll reflect on his childhood in doing farm work and what it means today. Congressman Ruiz, thank you again very much.
Thank you.